Now, is it any wonder that the NHS is constantly crying out for more Wonga? Well, a new report out today has revealed that hundreds of health bosses are pocketing salaries higher than the Prime Minister's. Now, despite failing to bring down waiting lists, almost 1,700 bureaucrats at the NHS trusts were each given more than £100,000 a year, and over 500 of them earn more than the Prime Minister. It's an astonishing story. Let's get the full detail now, because I'm joined by the media campaign manager at the Taxpayers Alliance, who conducted this study, William Yarwood. William, always an absolute pleasure. Hope you're also having a spiffing bank holiday. Another report that pulls into sharp relief the amount of money being pumped into the NHS. Simply eye-watering. Tell us, who are the worst offenders?
Yeah, sure. Well, good afternoon, Martin. Thanks for having me on the show, and also happy birthday to your son. Great to see the video you put on early on in the show. It was fantastic to watch. But yeah, this is the first time we at the TPA have actually done a sort of broader NHS Rich List looking at the senior managers in our National Healthcare Service. And as you said, we found some pretty shocking figures. The problem with this paper more specifically is that we're looking actually about the performance in relation to pay. And what we're finding, Martin, is that performance is not related to pay in many cases. So I'll give you just two quick examples. So for the highest salary we found that the University Hospitals Plymouth had a senior manager who had, wait for this, £382,500 in salary over the last year, which is absolutely crazy. And get this, Martin, this trust was ranked 95th out of 136th in England for A&E waiting times. Where is the performance connected there? And yet, hilariously, for another place, we found that Queen's Victoria Hospital had the best A&E waiting times of all the 136 trusts, and yet their chief executive did not receive over £100,000 in salary. So there's a bit of a discrepancy here. So the people who are running decent hospitals and running decent trusts are not getting rewarded, while those who are running bad trusts are. It makes no sense to me.
And William, it's just brain bending that 512 bureaucrats can be on more cash than the Prime Minister. And I wonder, are we in this cycle, a bit like the BBC? We seem addicted to paying top-end private sector salaries for outcomes that are clearly below private sector goals and attainability. If you're doing this in the private world, you'd be getting the boot, you'd be getting the old Spanish archer, you'd be getting the elbow. Instead, they seem to be more or less, ironclad and safe. I put it to you, a lot of people look at these figures, William Yarwood, and say, maybe it's time for a full audit to the NHS. Maybe it's time for a full US-style Doge. Look at where the wastage is. Make all these people reapply for their jobs on a set salary. If you don't like it, do one.
Well, Martin, I work at the Taxpayers Alliance, so I'm always pro a good old public sector audit, so I'm not going to disagree with you on that one at all. But yeah, I mean, the Secretary of State for Health, Wes Streeting, is apparently quite concerned about this as well and wants to specifically tie performance to pay in NHS trusts, which I think is a positive step forward. But the question is he going to be able to actually implement it? Whenever you criticise or do anything with the NHS, there's always, rumblings and rattlings, and people threaten to go on strike and people threaten to cause trouble. So actually reforming the NHS is one of the most difficult things to do in this country. But we hope that this paper and the numbers we revealed will actually encourage the Labour government to go a little bit further and be stalwart in their plans to reform this system, because it's quite clearly it's not working for patients, and it's clearly not working for taxpayers with some of the salaries that we're seeing.
And William, when you look at some of the eye-watering salaries you've highlighted, an excellent report, by the way, well done, you keep smashing them out of the park. East Cheshire NHS Trust, the salary there, the CEO, £367,500. William, that's like 12 nurses. That's 12 nurses' salary. I put it to you, if the general public was given the choice between one middle manager and 12 people helping them get appointments sooner, helping the public get healthier quicker, it's a no-brainer. It just seems we are front-loaded, top-loaded with bureaucrats, with red tape, with management. And isn't that the problem?
Yeah, of course it's the problem. And that's just the case across the entirety of the public sector, whether it's quangos, whether it's the civil service, whether it's town hall bosses who also receive high remuneration packages of £100,000, £150,000, £200,000. You've seen the types of reports we've done. And every single time what we're seeing is there's no link between performance and pay. Now, if our civil service was working well, if our NHS was working well, if our bins were being collected by our local councils, and yet all of these backroom bureaucrats were being paid decently well, I wouldn't have that much of an issue issue of it if everything was working well. But the point of the matter is, Martin, nothing seems to work in this country, and yet salaries, pension contributions and bonuses for bureaucrats just seems to go up and up and up. And I think in this case, we're in a country which is ran by bureaucrats and for bureaucrats and not for ordinary hard-working taxpayers.
William Yarwood, I couldn't put it better myself. An excellent report once again. Thanks for joining me on the Bank Holiday Monday. The truth doesn't have days off. William Yarwood, the campaign manager there at the Taxpayers Alliance. Thank you very, very much indeed.